Hello, this is Dr. Lewerenz, Longevity Health Institute here in southeastern Michigan. A few locations, 7 practitioners doing the best in integrative, personalized wellness, preventative medicine. The Galleri Test, a multi-cancer screening early detection test I want to share with you what we've been doing in the practice this last number of months. This is a new test coming out the last year. The Galleri Test, you can look this up and get more information, but why I'm an advocate and I want to share this with you is because I think it's on the cutting edge of how we should be looking at and screening for cancers, okay? The reason is, and this is going to sound very, very new and novel and, kind of interesting, but also kind of scary. So put fears aside, we start educating, opening your mind and forward thinking, because that's how we get places, forward thinking, okay? So this new novel approach to cancer screening is very, very interesting because we are testing cell-free DNA from cancer cell types. So it's a simple blood test that's drawn in your office. We do it here with patients. I've done, I think, 3 today on patients. And we usually recommend it in higher risk patients over the age of 50. Maybe they've had history of cancer. Maybe they got a lot of family history of cancer. Maybe their immunity's off and low. And that's why this should be used, okay? Now, we just started using this in the practice, but I'm a strong believer that it's gonna change lives, save lives, help families, and help be extremely, extremely on the cutting edge of a different approach to how you do true prevention and wellness, because this is what's going to sound scary and interesting, but cancer is a normal cellular change in part of life. You heard me right. Cancer is a normal part of life. If we are graced enough to be on this planet and live long enough, okay, over the age of 50, nearly 40% of us in our lifetime will develop a cancer, okay? And yes, there are good screening tools that are already being used, like mammograms and colonoscopies and, other tools, for cancer that are kind of controversial, like a PSA, things like that, skin cancer exams, etc. But it leaves a lot unknown and leaves a lot till we have a tumor, till we actually have a tumor progression. Well, this is a different approach, okay? By a simple blood test, they're getting literally over 50 different types of cancers, okay, detected by DNA. So it does not mean that you have a tumor. It means that you have DNA signaling from a unhealthy cell that has cancer DNA, okay? So that means circulating cells. Well, there's animal studies that show that we develop cancer 7 years before a tumor shows. 7 years. Our immune system takes care of it. We detoxify it, or it progresses based on immunity risks, carcinogen risks, radiation risks, EMF risks, etc. That's why how we eat and how we live and our exposures are so important, okay? But catching it this early with this type of test, with the Galleri Test, now you have a signal without any symptom, okay, that is extremely sensitive, meaning the accuracy of it is over 90%. And this is pre-tumor. So meaning, let's give an example. You pick up lung cancer and that cell type and that DNA signal. What will we do? Well, this doesn't mean you have a cancer tumor in your lung. What it means is we need to look there, CT, chest x-ray, etc., for something. May not show, but we're going to screen you closer. We're going to build your immune system. We're going to do preventative things, okay, to squash that immune issue and that cancer cell in your body and retest you to make sure it's gone. But God forbid the tumor shows up, okay? You're catching it at the earliest stage 0 or 1, and typically those are the simplest therapeutics there are out there, like, lumpectomies and biopsies and simple removals, not radiation, not chemotherapy, not all of these, things that are really life changing, even if they're life-saving, okay? So earlier detection is everything. That's this key thing is early detection is everything, and it's by a simple blood test, okay? I'm gonna give you some statistics. Head and neck cancer, which is horrible. I've personally been infected in my life, in my family. I have a great friend that passed away from head and neck cancer. I have a great friend that just went through therapeutic. Head and neck cancer is on the rise, okay? We don't know why yet. We have theories, somewhat virus related. We know that sinus, okay, and nasopharyngeal cancer is at a risk from Epstein-Barr. We know that human papillomavirus, HPV, is related to oral pharyngeal cancer, head and neck cancer, okay? So viruses are probably the cause of this to some degree. I have theory that a lot of it is caused also by EMFs and some of our exposure in the environment, okay? But that would be detected on this test before you had a tumor. So the therapy you would have would be very small and targeted versus something much more difficult and aggressive and et cetera to deal with. So I'm offering this here at Longevity Health Institute to all our patients and encouraging patients. It is scary a bit, to think of. We got to wrap our head around about this because it's a new way of screening for cancers and thinking of cancer. But screening to wait for a tumor and seeing a tumor, we often are catching those then, not just in their 1 cell, 2 cell, 4 cell, but they're thousands. They're a tumor that's progressed. Now there's got to be more aggressive therapeutics like surgery, radiation, chemotherapy. This would prevent that. So think about getting a Galleri test. Here at Longevity Health Institute, we draw it here every day. It takes about 2-3 weeks to get the result. When you get the result, you are negative or you are positive and it tells the cell type. So we would know we're looking at ovary or pancreas or prostate or thyroid or breast or colon, etc. Okay? So any questions, we're here to help you here at Longevity Health Institute, guide you in the best preventative wellness-based medicine and always doing the right thing. This is Dr. Lewerenz. Be well.